Nigeria, the most populous black nation in the world, with an estimated population of over 100 million. The average life expectancy in industrialized nations is well over 75 years. In Nigeria, it is 46 years and falling. This is not a spiritual attack. It is most likely due to a combination of high blood pressure, raised cholesterol, and increased levels of sugar in the blood. But more importantly is the fact that this could have been prevented. Access to better healthcare and education are major factors in increasing life expectancy. See your doctor and know your diagnosis. Even mild symptoms should not be ignored. Always insist that your lab tests are done in a reputable and reliable laboratory that gives accurate results. Pathcare Nigeria, the first ISO accredited laboratory in Nigeria, was established just over a year ago in collaboration with Pathcare International, a leading global pathology services company with over 150 laboratories worldwide. Pathcare Nigeria is a fully computerized, state-of-the-art laboratory that offers the widest range of diagnostic tests in Nigeria. These include
specialized hormonal profiles such as thyroid and parathyroid, infertility and growth hormone, diabetic testing including HbA1c and C-peptide, allergy testing for asthmatics, genetic testing, drug screenings as well as drug monitoring, PSA, pap smears, DNA paternity testing, and many more.
But how important is proper testing?
Very important. I think one of the tenets of medicine is making an accurate diagnosis, and there are different ways in in which a diagnosis is made. First of all, from the history and physical examination, but in many instances, to confirm a diagnosis, you need to do some laboratory work. For example, obstetrics is pregnancy is a time when we're wary about using medication, and therefore medication has to be used with good reason. And the only way you can do that is to be absolutely sure of the diagnosis.
In the specialty which I am in, which is endocrinology and metabolism, without confirming the diagnosis with adequate laboratory workup, the practice is virtually non-existent, because most of our decisions that we make, they are based on having reproducible and reliable results for the hormone analysis and other metabolic parameters. So without having adequate laboratory backup, our practice is greatly impaired.
Because there are so many types of arthritis, actually more than 200 types of arthritis, that's quite a lot. And because they are caused by so many different causes, it is important we identify the cause of each and every one of them, because the treatment of one type of arthritis is actually different from another type of arthritis. And part of the way we can do this is by having investigations. Laboratory investigations are quite critical, very important in the management of many of these cases, especially those cases we call connective tissue disease, or what we call autoimmune disease, in which the body seems to be at war with itself.
One cannot overemphasize the importance of doing the appropriate investigations, because if this is not done, you could actually be treating the wrong disease. So if you do this, then you reduce the chances of treating the wrong disease. Because obviously, if you're giving medication and you're treating the wrong disease, then the patient doesn't actually respond to treatment. And this sometimes results in death.
In pediatrics, proper testing is essential. It's important, particularly in children under the age of 2 who are not able to communicate with us. We rely on the mothers to communicate, but despite that, in this age group, diagnosis is difficult for the reasons I've already said. So reliable testing is especially important.
The use of laboratory investigation, as I said, is very essential. And an example is you have a patient, you make a clinical diagnosis which you relatively certain of, and you did not investigate the patient and you commence the patient on therapy. If it happens that the diagnosis is right, but the patient does not respond to that particular drug, not because the diagnosis, but just the drug is not good for the patient, you become confused and you're not sure whether the diagnosis you've made is right. But if you have confirmed the diagnosis before therapy, then you're relatively sure, and then you can say, all right, let's try some other medication confidently. In actual fact, investigating the patient properly prior to commencing therapy actually gives the doctor a lot of confidence in management of the patient, and actually produces better results.
For the proper management of their patients, doctors must receive accurate and reliable results. To achieve this, the laboratory must have in place a quality assurance program that runs from the beginning to the end of the testing process. Our tests are conducted by a team of dedicated professionals trained to international standard and using the latest sophisticated laboratory equipment and technique, which before now was found only in advanced countries. Pathcare Nigeria is committed to providing fast, accurate, and reliable results to our numerous clients.
Pathcare Nigeria offers the widest range of tests that are available in Nigeria today. Many tests people used to have to go abroad for, they no longer have to do that as we offer it here. Tests ranging from the most basic to the sophisticated. We offer a range of specialized services. To the doctors, we provide additional value to just giving a laboratory result. First, by giving we have pathologists, in-house pathologists, who are available to discuss cases and add input into patient management and give advice, professional advice. In addition to that, we also are able to give more advice from the pathologists in the sense that if patients if they require additional information, we provide that for them. On a more physical sense, we go to hospitals and pick up samples and deliver reports to hospitals using our dispatch riders. And we also have an additional service, which is the email service, which we're the first in the country to provide that service. And for doctors, we are able to send their tests by email or the results of their patients by email to them.
Experts have this to say.
Pathcare has been quite useful in my practice as a neurologist in the past 1 year since they started, and I have been part and parcel of the Pathcare phenomenon, if I could use the term. Specifically, as a neurologist, I treat a lot of patients with seizure disorders, epilepsy, and they are usually on anticonvulsants. And very often we need to measure the blood levels, the serum levels of anticonvulsants to be able to determine, one, whether we are giving appropriate dosage, and very often to also determine compliance, whether the patients are actually taking the drugs. And before Pathcare came into Nigeria, we didn't have this facility. In fact, patients had to go abroad very often to have these tests done for the ones who could afford it or who could have scheduled vacations or trips to go and have this done. And even in some rare situations, we may have to have these blood samples couriered to laboratories in Europe and have the results sent back to us at great expense and also at great uncertainty and risk, attendant risk with sending blood by courier companies who are not scheduled, or you don't have a specific packaging plan with them. So that has actually enhanced my own practice, at least in that particular aspect.
Pathcare has, anybody going to visit the facility will, without doubt recognize that Pathcare is a major player in healthcare delivery system in Nigeria nowadays. I've been using the laboratory for a year now, and I'm extremely pleased with the results we're getting from them, both in terms of their accuracy and their speed in getting the results out. Apart from Pathcare being a laboratory that is giving us results of international standard, they also are able to provide us certain, investigative procedures which are not readily available in Nigeria previously. Like, we can now monitor blood levels of certain drugs. Like if you put a patient on medication for heart failure, digoxin, or for depression, lithium, you want to know the blood levels, and Pathcare does all these analysis. Also, if a patient is having infertility problems and you want to, find out whether there's a hormone problem, Pathcare also provides hormone assays using ELISA. It's a new technique. Also in DNA, like if there's a paternity suit, somebody's not sure whether a child is theirs or for whatever reason, they also provide that. And other very rare blood tests are being carried out. Tumor markers, like a patient who want to screen for prostate cancer or colonic cancer, they also provide. So they're contributing immensely.
Pathcare had a positive impact on my practice. I'm a urologist, and I see a lot of patients with prostate disease. One common ailment is in this environment is prostate cancer. There's a blood test called PSA, which we do to screen and also to assess when you have a suspicion of prostate cancer. It's important that you get the accurate result of this PSA, and it's also, although the final diagnosis you make on prostate biopsy, but in the past we've had problems with getting accurate results of the PSA until Pathcare came along.
Well, quite clearly it has assisted one with the management of a lot of patients, particularly those specific to my subspecialty, patients who develop